Hi, my name is Joe. I'm one of the veterinary surgeons at the Pet Vets in Rotherham, where we are today. I'm here to talk to you a bit about arthritis. That's a condition that happens in unfortunately, most of our companion animals. So arthritis is a complex disease. Okay, it can involve inflammation in the duration of one or more joints. So it usually has signs that gradually get worse over time and as time goes by. So usually the main thing that you will notice with your companion animal is that in the beginning they may be reluctant to say go upstairs, they may start not wanting to walk as much as before, and they'll be most likely becoming less active on walks as well. So they may become a bit more stiff after they get up or after long walks. It could always be the earlier signs of potentially arthritis. So usually other things that you will tend to see as well is that they may become lame or stiff in one of the specific limbs. Most of the times what we tend to have is we tend to have clients that come in and they say that their dog or cat is not in pain, they're just lame on the leg. But we do know unfortunately that if they're not weight bearing on the leg or they're lame, that is unfortunately a sign of pain or discomfort that needs to be looked at. Other things you may notice is that your companion animal may be reluctant for you to touch certain parts of the leg. They may be wary of you going near the limb and the joint, and you may even notice that there's some muscle wastage going on the limbs. Okay, you may notice that they start to lick the joint as well. That could all be early signs of arthritis in itself. So usually what causes arthritis, it can be as they get a bit older, the capsule starts to degenerate, but there's also some predispositions. So some dogs can have hip or elbow dysplasia, or they could have ligament injuries, that they could have patellar luxation, so different things that can predispose for arthritis. The way we tend to diagnose this and to provide you an answer is we tend to do a thorough exam to identify the location and the source of pain, but sometimes we need to also do some x-rays or CT, like the one just behind me, to try and provide you with a better answer and understanding of what's going on. Because based on that, then we'll be able to provide potentially a better outcome and better treatment so that your dog or cat is more comfortable. The way to manage arthritis is to assess the underlying cause. So not all dogs or cats will need the same treatment. Some of them, for example, could be weight. They may need to lose a couple of pounds to make them help walk a bit better. Some of them may need hydrotherapy or physiotherapy to help regain some of the muscle. But some of them may even need anti-inflammatories, for example, to make them feel more comfortable. We always have to tailor that treatment based on the location of pain and your patient and any underlying conditions. So if you have any further queries or questions, we would be more than happy to help you, and we'll see you at the appointment. All right, take care.